During the worldwide COVID crisis, Laos, a country north of Thailand, has been one of the rare and lucky countries in the world where only a small number of people have contracted the disease. The Lao government has reported only 1,177 cases so far, with the majority of those being detected in the last month. The Lao Prime Minister has ordered a 2-week lockdown in the country until May 20 in an effort to contain the COVID-19 outbreak, which spiked in mid-April. The country recently recorded its highest number of confirmed cases in one day, which was 105 new cases. The government has prepared 3 field hospitals and 1,200 beds in Vientiane, the capital of Laos, to treat and contain the virus. The government has also banned travel between the capital and the provinces and has moved to clamp down on illegal border crossings from Thailand, which is currently in the midst of its worst outbreak of the virus since the beginning of the pandemic. The government will look at easing restrictions where there are no cases of COVID, but tight restrictions will remain in areas where clusters of COVID infections have been identified. Because of the low numbers of COVID cases previously, not all the Lao population are happy or understand the need for the new COVID restrictions. Some Lao residents have caused problems for local health officials who are trying to contain the virus. Some people who have tested positive for COVID-19 have refused to be admitted into healthcare facilities. Other residents have broken COVID-19 prevention rules by holding large gatherings. So far, there have been no COVID deaths in Laos, which is a great result compared to other countries worldwide. While the Lao government is taking swift action to preempt the spread of the virus, a serious outbreak would effectively wipe out the hard-won gains of last year and compound the country's economic problems still further. Laos has suffered badly because of lack of tourists in the last year. Foreigners are currently not allowed to enter Laos except in very limited circumstances. To enter, you'll need prior approval from the Lao Ministry of Foreign Affairs and a negative COVID-19 test conducted less than 72 hours before you travel. You'll also be required to quarantine for 14 days at a government-designated venue at your own cost and obtain insurance to cover the cost of treatment during the quarantine period. Thanks for watching. Please like and subscribe to the channel to help the channel grow.